What's up, guys? It's Dr. Bailey from Evolved. Wanted to take a second to hop on here and just do some basic updates. I'm going to give it a few seconds and hey guys, Dr. Bailey from Evolved. Figuring out this new Facebook Live option we got going here, but want to take a few seconds, get online, kind of give some updates and try to keep everybody informed on kind of what we've got going on, what I've got going on. I'll give everybody just a few seconds to kind of populate here. We're definitely seeing some interesting times with Corona, with COVID-19, seeing everything that's going on from that standpoint. We definitely have looks like some light at the end of the tunnel in regards to that. One big thing I definitely wanted to put out in regards to Corona, right now there's two big trains of thought or schools of thought. You got a group of individuals that are super concerned about, catching Corona or infecting somebody with Corona or dying from Corona. And then you've got a group of individuals that are very, very concerned about feeding their families or keeping their businesses or keeping their houses. And so one thing to remember with that is they're both valid. They're both real fears. They're both real concerns. And one thing that we've got to try to do is look at it from both sides of the fence. What can you do? We know that social distancing is working to a degree. Absolutely. Hospital censuses across Tulsa are actually down right now. With that being said, the patients that they do have are pretty sick. They're requiring specialized care. They're requiring specialized staff, which does definitely, again, put some strain on things. From a patient perspective, we're seeing pretty decent responses. Some research coming out with zinc. I always highly encourage some sort of natural or mineral uptake if you can. About 50 milligrams of zinc twice a day, 1,500 milligrams of vitamin C twice a day. Definitely is not going to hurt. It's definitely going to help. The big thing to remember, hand washing. There's a big push right now with PPE and masks and gloves. One thing you got to remember with PPE, though, is if it's not done correctly, it can actually make things worse. PPE can be a vector for transmission. When we see it a lot, we see folks with gloves on and masks, and they'll go, say, gas pump, have their mask on, have their gloves on, go adjust their gas pump, and then play with their adjust their mask. So one thing that just try to keep in mind is if you wear an N95 or you wear a mask, you wear a facial covering, once you've got it on, you got it in place, try not to adjust it or play with it throughout the day or however long you have it on, especially if your hands have been touching other things or you've had gloves on and touching other things, because it really kind of defeats the purpose and point to reduce transmission. Again, biggest thing is going to be our at-risk population, and we've seen it in the numbers even in Oklahoma right now. It's predominantly in our 50s, late 50s, early 60s. I believe the highest group was at 65 and above. Hey, how you doing, Jimmy? It's the same type of population we've been seeing across the world. Really, there's a lot of really interesting things that go on with this virus. We're seeing some concerns or some thoughts about some possible genetic predisposition, populations at risk for thalassemia and some different blood issues, microemboli or like pulmonary embolism, but on a small degree following some of these issues with like cytokine storm and whatnot that we're hearing about. What else? I think that's the primary big things right now. We're continuing to do our telemedicine platform. So what we're doing with that is I've lowered the cost of all of our concierge visits to $40. I'm able to do pretty much everything with that except for labs. I've worked out some contracts with some places here in Tulsa to be able to get labs for anywhere from $20 to $40, depending on what all you need done. So if you don't have insurance or you don't really have the capability of getting into your doc's office, I can see you remotely. We can get you taken care of that way. We are also now servicing Arkansas patients as well, which has been a big deal, and it's been an interesting deal kind of seeing how that program has developed in Arkansas compared to Oklahoma. I'm also now the medical director for St. John's or Ascension's Hospice. A lot of people know that I've been in and out of hospice for several years now. And one of the big things for me is being able to provide at-home care or house calls, which right now is a little bit peculiar, different with COVID, obviously. But outside of that, I think that that's something that we really have missed in medicine is physicians being able to come to your house and take care of you. And especially in a hospice setting, I think that's a big deal. Having the capabilities to sit and talk with the doctor instead of just having the nurse, which I love my nurses and love having the fact that they can go in and take care of patients, but being able to work and see the patient in that setting is a pretty powerful tool. If you or anybody else is curious about or is wanting to talk about hospice, definitely you can always hit me up through Facebook. Just shoot me a message through the Evolve page, through any of my Facebook profiles there, and I'll be glad to get you taken care of or work towards your family member. One thing that I always try to, which I think is pretty well documented right now, I'm a big believer in natural processes if possible. That's hence our cannabis program in Oklahoma and Arkansas. And I think that there's a big area there that could be taken advantage of as far as helping people treat symptoms. I think that's a big thing again. Let's see here. What's up, Lyndon? How you doing, sir? Wanted to, like I said, just jump on and kind of give some updates. Also worked with New Pharma up in Owasso, Chip Paul, which Chip's pretty well known in the not just the cannabis world, but the CBD world here in Oklahoma. He's got some really solid patents in place, as well as research-based evidence for CBD and some different natural remedies that I felt pretty strongly about. He's got some new products out, a couple that I've partnered with him to help him kind of produce, and you'll see those popping up on the Evolve page as well. Oh, I feel like that's probably the biggest things right now. I said just gonna hang out for just a few minutes, gives people time. If anybody has any questions or want to ask anything, it's one thing that I've always tried to pride myself on is being accessible, right, wrong, or indifferent. So if there's anything that I can ever do to help, like I said, it's very, very rarely are you going to get a response from anyone other than me. If it's Evolve related, I try to make sure that I respond to everything. So let's see. Now the big question we keep getting is as far as a physical office. Definitely something we're looking into. I'm not 100% sold on it just yet. I've had a couple different in the past 2 or 3 years. And with everything that I do with my responsibilities with the National Guard, as well as my responsibilities with Ascension or with the hospice program and then Evolved, and then also I still fight as well in several of the local MMA shows. Having the physical building does kind of set its own set of difficulties up. So we're kind of playing that by ear. There are some options. There's definitely some options out there and something we're looking at. What's up, Shay? Man, I'm glad to hear that. It's been, across the state of Oklahoma, we are roughly 24,000 patients deep in the cannabis side of things. From Evolved, we have donated, cannabis last check, it was about 6,500 recommendations since we started July 28, 2018. I was sitting back and thinking this morning, we actually donated, we were the first free patient drive in the state of Oklahoma. Veterans Day, 2018, we saw 100 and I believe 18 veterans for free that day. And then we started traveling the state first. Back in October, we went to 2018, we went to Grove or Fairland, and then we went several times to Moore and Woodward, Enid, to Lawton a couple different times, kind of traveled all over. But it's been an amazing thing to see. For people that are still kind of curious about, how the cannabis stuff has done, we have decreased pill counts in the state of Oklahoma by almost 500,000 pills since July 2018 to present. And those are based off of PMP or physician monitoring reports. And actually, it's probably higher than that. It just kind of started to lose count after a little while. So we've seen it work. We've had some phenomenal responses in regards to cancers as far as diabetes. We've actually just had our 32nd patient cured diabetes the other day. Not just with cannabis, but cannabis definitely helps. Humulene is a great terpene for appetite modulation and blood sugar control. One thing that we look at a lot of times, and everybody has heard about, is the munchies after cannabis use, whether it's inhaled or an edible or whatever it may be. But part of that process is it increases your metabolic rate and your blood sugar drops. And as your blood sugar decreases, you get hungry. And so a big step we've kind of learned to gather up is decrease carbohydrate intake with our diabetic patients. Not type 1, only type 2. And then combining that with our cannabis program, it's worked exceptionally well. Cannabis is well documented to adjust and modulate blood sugar. And so it's something that a lot of people weren't really thinking about it and considering. Another big thing is weight loss. We've had a huge number of patients with significant weight loss at 6 to 9 months. So again, I think that there's a lot of folks. There's been a quality of life change that wasn't expected. So when I had my physical office, we were sitting at I think our average age was 61 when I transferred from physical to telemed. Now we have dropped a little bit. We're down to 58, I believe, is the last check on the average age, but that was kind of expected with technology and whatnot. But it's still not what I think the state is expected. Let's see here. Hey, Cole. So what's going to be is if you're a patient of mine and I did your initial recommendation, the renewals are going to, in the state of Oklahoma, are going to be 45. And it's a little bit different in Arkansas only because those patients are new to me and we're still working through how we're going to adjust those. But for right now, Arkansas patients are 75 and Oklahoma will, like I said, if they're renewals from our previous patients, only be 45. And it's going to continue to adjust. My goal is to try to get those as even as possible. Let's see here. Shay, strong work. I think that's a big thing is the medications. And sometimes when I do my follow-up appointments with patients, and the big things I always ask is, any new medical conditions, and then how are we doing with medications after the initiation of cannabis? Because my goal from the very beginning is not to just add cannabis to whatever we're doing, but use cannabis to try to decrease our reliance or need for not just mind altering medications, but life altering medications. Everybody's heard about the opiate epidemic that's going on. There's also a huge issue with benzodiazepines, Xanax and Klonopin and Ativan that doesn't get near the press, but causes huge problems. With that, it's something that, again, it kind of sounds cliche, but it just comes back to quality of life. Let's see here. Hey, Blake, how you doing, sir? One of the, let's see here. Shannon, same thing. So the renewal process, what's going to happen is the website is being updated as we speak, and the state of Oklahoma will not accept renewal applications or updating your card until 30 days prior to your expiration date. So what's going to happen is the very first licenses were granted the first week of September in 2018. So the first week of August or the end of July, our website's going to have an option for Oklahoma recommendation renewal. And so those are going to be, like I said, $40 to $45 in that ballpark range. You'll basically just book that appointment. We'll get you set up, get your new form set up. One big problem that is going to occur, and not my patients, but just in general, what we have all these big patient drives that we've done over the years. We've seen patients show up in the hundreds, and a lot of times they got assistance, Well, in order to renew your license, you're going to have to be able to log into your previous account. So one thing I'm going to try to strongly encourage folks to do is, hey, figure out what your account issue is. If you know your email, go ahead and try to log into it and reset your password now. Do those things ahead of time. That way, when it's time to renew your license, you're ready to rock and roll. But what'll happen is the renewal process is basically just uploading a new recommendation form, making sure that the addresses and stuff are updated. Like for mine, the initial ones that are going to be renewed, the address is going to be different from the 721 Queens to 811 West New Orleans, so that'll need to be updated. I am not sure yet if it'll require a new photo or not. I suspect that they will, but I'll find out more on that as we go. John, we shouldn't need to defer any expirations yet. And the only reason I say that is because there shouldn't be any expirations till later on. And then Blake, yes, brother, we'll get you taken care of probably, like I said, in September. The big thing is make sure that everybody's letting everyone else know, hey, start planning for this as far as the renewal process goes. I don't expect it to be super difficult, even though the OMMA is the OMMA and they're a government-run deal. It's going to be something that we'll probably have some bump in the road. Let's see here, Miss April. Now, everything on file, we do not keep your OMMA logins or passwords. And so I did that on purpose. I didn't want anybody having access to those things because that's your personal private information. It was just too much that I didn't really, I don't want to say wanted to keep, but didn't want that extra liability. So I made sure that we didn't keep those. Now, it is pretty easy to reset that. And I think it's something that we can work on doing pretty easily. Let's see here. Yep, Barry, you'll be up for renewal. I remember doing yours. And then let's see here, Blake as well. And then that was Miss April. This is a prime example of what I wanted to try to do, just try to answer any questions that may pop up and that people may have. Let's see here. The expirations was a big one. I can tell you that I suspect, at least, that there's going to be some with the next presidential election. We know that things are going to change in regards to cannabis. Does anybody know how they're going to change? No. I think that anybody that says they know is folly or telling a fib. But what do I suspect is going to happen? I suspect that the federal government's going to do this number and waive it and say, you know what, we're going to defer it to the states. That's just kind of my guess. Looking at things and how legislation's come down previously and how things are being handled, currently. Is that good or is that bad? It's going to depend on the state. Oklahoma's done fairly well. You've got Arkansas who struggled a little bit, depending on the legislatures and the kind of view of the program there. What else? Let's see. Didn't miss anybody. All right. Yeah, that'll be the biggest things to see is the renewal process, and then how is that going to be affected by the federal government and legislation that affects not just cannabis but CBD and whatnot as well. Speaking of, I will post here in a moment. I actually partnered with Chip Hall. I kind of spoke on this briefly earlier. His program, New Pharma, out of Owasso. It produces CBD product, and with everything I've done within the industry and as far as cannabis and CBD and whatnot in Oklahoma, I've been approached a ton about different companies. Hey, would you like to partner with us, or would you like to help us do this? And one thing that I really liked with what Chip has done is he's got patents and a lot of research behind his products, which to me is important because nothing is more difficult than when you're talking with a new patient that is curious about cannabis or CBD. They're like, well, I tried CBD, I got it on Amazon, and it didn't do anything for me. And I'm like, well, that's very possible, and it depends on how it's broke down, what the substrate that it's dissolved in or worked with, and whether it's, a lot of people are using MCT oil. The one thing I really like about Chip is he uses fruit and vegetable oils, cranberry oils, different things like that for absorption processes. And we actually worked on a product starting back in the late fall, early winter that being a hospitalist, one thing that I've seen in medicine for a while is in Tulsa, especially. I'll speak on Tulsa specifically, but November through March, we were almost always at capacity due to influenza. Just about always. Most of the major hospitals would go on divert, meaning not accepting outside patients, but they would accept through the ER. And so my goal was to try to find a way to treat things as naturally as possible, and add the augmented capability of CBD, which is a potent anti-inflammatory antioxidant. And then, at some point, possibly looking at THC as well, but CBD currently. And we started working on some product that I felt pretty good about. And when you look back to the SARS outbreak, it was a huge push to use cranberry, or not cranberry, I apologize, licorice root, because of a compound glycyrrhizin that's in licorice root. It was found to have a very potent antiviral mechanism. And so talking to Chip, we started looking at other natural things that we could combine together to give us a potent boost for our immune system going into the fall and winter. And then, unfortunately, Corona happened. And so we kind of sat there and looked at it for a little bit. And then when we really looked at it, Corona is actually an RNA type of virus, falls under the SARS grouping. And so after we discussed it, I feel like the product that he developed and that we kind of put together is pretty solid. Well, one point I do have with it is I feel like from a natural supplement, it's great. I feel like it's got a huge potential to really take care of folks. But on the flip side, I don't like the price point. I feel like it's a little bit too high. And so we're going to work to try and address that. But it's made with licorice root, sage, lemon balm, ginger root, and sweetened with agave with some CBD in it as well. Come in little shots. I typically, what I'm recommending right now, what I use is, traveling to nursing homes and hospice patients and making sure that I'm staying as healthy as possible is 1 to 2 a week. And then when people are acutely ill or recovering from illness or exposed, try to increase it from there. Because if you can actually go onto the NIH website and find several also Lancet studies that show some pretty solid research-backed data on the antiviral mechanisms there. Let's see here. Yes, absolutely, Blake. Oh, and that's kind of an interesting point that you hit, talking about, being a transplant patient. I've had several patients that have hit us up about Corona and being on biologics for like rheumatoid arthritis. And initially, I was concerned that, that's going to give us an increased risk of infection, which we know. But with Corona being new, there's so much happening with it, I was actually set in on a conference call the other day with not a rheumatologist and infectious disease doctor from New York, and they had the rheumatologist had a very interesting point. He said, we're actually encouraging our rheumatoid patients to continue with their biologics and continue with their medications for a couple reasons. One, to decrease the likelihood of having a flare and ending up in the hospital on an already strained system, which made sense. But then on the flip side of that, what they're seeing is part of the mortality or risk that is happening with Corona is the immune response, the cytokine storm, and you basically are getting healthy tissue destroyed due to the immune response of the body trying to kill the virus. And so what they're seeing is some of these biologics, which is where Plaquenil, some of these other medications are coming in that help fight autoimmune disorders and whatnot. But you're seeing that by decreasing the immune response, we're actually having a better outcome in some small cohorts. And so it's going to be, again, Blake, that's an interesting point that you made with the autoimmune and immune weakness. Again, though, the best thing for anyone that's immune compromised is going to be avoiding touch, avoiding crowds, even for just a short while. One of the big things that I'm concerned with now is not, I feel like that we're getting things under control. I am a little bit nervous about the economy, I'm not going to lie. But when we come out of quarantine, the virus is we still have an unknown number of carriers. The numbers are estimated all over the place in the thousands or 100,000s across the Midwest United States. So definitely this is going to be something that's going to kind of play at it for a little while. It's something that we're in uncharted waters as this history and being made right now. There's going to be some really interesting research come out of this. There's several studies. I know that one of the really, really super intelligent ladies I went to medical school with is working for the state medical examiner. They just had an article published the other day in one of the big journals about autopsy and looking at cause of death in COVID patients. So definitely something to look at and consider. Let's see here. Yeah, feel free to share this video. If there's anything I can help with, let me know. Like I said, I try to make sure that I'm readily available. You can get to me through the Evolve page. You can get through me through the Evolve website. You can message me directly. Like I said, I try to make sure that I'm one of the most accessible doctors in the state, regardless of the reasoning, whether it's medical, whether it's hormone replacement, whether it's cannabis, whether it's just diet and nutrition. That's another thing I'm going to be doing pretty soon is some lives from my fighter page. It's just Brandon Bailey, and trying to go over a little bit of nutrition and whatnot, because that's a big deal right now, especially with being on quarantine. A lot of people's diets are kind of going out the window. I'm not going to lie. I've definitely I've fallen prey to it myself. I do have what's left of my gallon of water for the day. That's something I talk about a lot, is making sure that we do the basic things to try to help us out. Thank you, Ms. Wells. Hope all is doing well with you. Definitely, Blake. We're working with it. It's something that one big thing I try to tell a lot of folks. I tell a lot of things apparently, but is that as a physician, I don't ever want to be the doctor that sits across from you and is overweight and smoking and drinking and everything else and telling you, hey, you need to drink more water and exercise and eat right. I feel like any advice that is good enough for me to give a patient is good enough for me to take. And so I try to make sure I live by that, good, bad, or indifferent. So it does give me a little bit of a perspective on what may and what may not work. Hey, Miss Lisa, I hope everything's doing well. I appreciate your help. You've been amazing. Let's see here. Greg, that is a big question right now is, when should you initiate something like a biologic? And I think it's going to depend on the issue or what part of Corona is causing issues. And what do I mean by that? So there is a big discussion on this PaO2 curve as far as oxygenation to tissues. We know that when patients get to the point where they're critical enough that they're requiring ventilatory support, that they're not, the likelihood of coming off the ventilator is not good. We're also seeing some concern for microemboli on a huge level, which is that's a whole other bucket of worms to try to deal with. And so what's causing the microemboli versus, are we just having tissue destruction? Or is it because of the immune response that could possibly be stopped with maybe a biologic or something to blunt the immune response? It's tough to say. They're talking about steroids was initially the big push, and then they're saying, well, we only want to use steroids in patients that are, ventilatory support. But then on top, now we come back and we're saying, well, ventilatory support, by the time we're getting to that point, it's no good. And so I think that there's going to be a lot of back and forth on it. It's like Plaquenil, honestly. There is a ton of studies on both sides of the fence right now on Plaquenil. A lot of people aren't aware of that, but there's some that show phenomenal improvement, but there's some that show none. And again, something I'm going to throw out, and I heard a guy mention in one of the video conferences I was sitting in on that makes sense to me, is you see like Italy got hit really hard, New York got hit really hard. There's a huge Italian subpopulation in New York, but one thing that is kind of universal is there's a high occurrence of thalassemia and blood disorders in the Italian, I guess, genetic line there. Is that playing a part in it? We know that some different blood disorders help are protective. Sickle cell can be protective against malaria and some other infectious components that affect blood things. You're absolutely right. Timing of initiation could be it. The problem is what's too early versus too late. And I think with that, what do I mean by that is we see a lot of patients that don't meet criteria for admission. They're sent home and then they decompensate over time, right? So they come back and their saturations are in the 60% range. I've actually seen a ton of patients through other physicians that well documented that they're sitting asymptomatic or without issues and without symptoms, and they have a pulse oximeter reading in the 60 and 70% range. Which if you're around a hospital or in a hospital for very long, you'll know that that's not good. But they're asymptomatic, and there's a lot of issues surrounding that. Of course, it's not a PaO2; it's just an SaO2, but still, it's trying to determine that initial point of when do we start treating with different things. Let's see here. It's actually a really good thought process, Greg. I like that. Yeah, I think. I missed that, Cole. Thanks, man. Yeah, we're looking. Sorry to bounce around a lot. Cole was talking about my previous fights. We're definitely going to fight again. We're waiting to see. I really suspect all mixed martial arts and sports type deals are going to come down the line, probably August, maybe September. I don't know. It's going to be curious to see because they're definitely not going to want large gatherings of folks for a little while. I know that most of the local shows here, they moved into late May, early June, but I don't even suspect those to go off at the time that they were hoping and that I was hoping, but still. Let's see, John, mass testing is the solution. What's this? I think you're correct. As far as numbers, I think that gives us a good number. My pleasure, Greg. I think one of the big things to remember with testing is this, everybody's been upset. We don't have testing. We don't have testing. You're absolutely correct. We don't. Should we? Yes, we're one of the most leading countries in the world. I think we should have testing, but is it going to change anything in the near future? Probably not. And what do I mean by that is, right now we're asking folks, hey, if you have symptoms, you stay home, stay away from everybody. And it's 14 days and most of the time, not all the time, but most of the time people, 95% of the time people recover without any issues, don't have any significant problems from that. And that's why you'll hear people say, listen, don't come to the hospital unless you have, life-threatening issues or emergencies. So testing is needed to give us numbers. Absolutely. I suspect again that we're in Oklahoma. We got 50, 60, 70,000 more positive cases than we even know about. Patients that are just walking around asymptomatically. Gordon, you're absolutely right. I think a lot of people have probably had this. there's some big discussion about, November, December. Everybody had this hacky, persistent cough and whatnot. I felt bad for a few days and then went on about their business. Let's see. The um, the issue is, how do you track the virus that people can carry without any symptoms? I don't know if you can. Now testing, Gordon, the big thing is what people don't understand is there's a multitude of testing as far as PCR testing. Is it antibody? Are they looking for pieces of the RNA of the virus itself? Are they looking for antibody production? Antibodies going to be the best determination because it's going to allow us to let us know, hey, is this acute or not? That's going to determine a lot, Gordon. And Johnny O'Brien. Yeah, I wish I had time to turkey hunt, brother. Let's see here, John. I don't, John, I don't disagree. But I think that the problem you're going to run into is determining, again, it's going to be the type of test and determining whether or not so antibodies, long story short, you have IgG and IgM, whether it's an acute illness versus a previous or exposure illness. And that's going to be a big predictor on that test. And so we've got a bunch of different tests that they're coming together with for this. But as far as what test is going to be available to necessarily to you, it's going to be hard to say. A lot of the private places are testing antibody, which is good. I'm not 100% sure yet. I get emails and faxes from the Oklahoma Department of Health all the time. And so I'll have to look and see what the last one was as far as testing recommendations on what they're leaning towards the most. I think that one of the things I talked about earlier, John, I think that everybody has to look at is how is the quarantine affecting folks? And nobody wants the divisiveness that it's going to cause, and it is causing. And, I said something again earlier that not very many people were on for, but if you really look at this and you look at the United States right now, you've got basically two big schools of thought. You got the people that are just scared to death of corona. They're scared of dying from it. They're scared of giving somebody they love it. And then you've got the folks that are scared to death. They're going bankrupt. Their children starving, losing their home, losing their business. And what we have to figure out is just as a population that both of these trains and schools of thoughts are correct. They're both founded. They're both real. And so we have to try to take them both into consideration when we look at things. It's hard because corona is a bad deal, and it's proven it's a bad deal. It's the death numbers don't lie. Is it affecting people that we weren't prepared for the most part? No. Most of the leading epidemiologists and leading infectious disease in the country, those docs are going to tell you, the vast majority of people are going to handle this without any issue, but it is definitely hurting those, and it is scary and concerning those for the at-risk population and those with decreased immunity. And again, that's going to circle back to doing everything we can to boost our own immunity. So making sure we're eating right, make sure we're drinking plenty of water. And the zinc we know helps when patients are acutely fighting off our illness, typically have a diminished serum level of zinc. So 50 milligrams, those small little white capsules of zinc or tablets twice a day, once in the morning, once at night. It's augmented with some vitamin C as well. There's some discussion on elderberry possibly contributing to some worsening of this, the cytokine storm. I don't know. That's going to be something that's going to take some research. I've used elderberry a lot. This is a natural prophylactic in helping. Let's see here. Hey, William. So all you have to do is if you just head over to the website, www.evolvedhealthandwellness.com. you can just click on book your appointment, and then you can just follow the instructions there. The new patient licenses are $75, and then we do a veteran discount and pediatric discount from there also. Let's see, where was I? Oh man, ask me some questions, y'all. Anything that you guys are curious about, whether it's Corona, whether it's, like I said, I'm now medical director for Ascension Hospice, so we'll have that as well. Frank, good question. There is some discussion, and here's the problem right now with our lack of research in cannabis. I think anybody that really looks into it knows it's a very potent anti-inflammatory and antioxidant. Definitely, Greg. I'll get that in just 2 seconds. And so, to me, it's going to be a hard deal. Now, anything that's inhaled is going to always put us at risk and concern, especially when we're dealing with lung issues, which is obviously the big issue we're seeing with Corona. So, Frank, I would suggest, at least if you're at risk or you're having exposure or you may possibly be recovering, I would probably abstain from smoking and vaping at that time. I'm of the mindset that, cannabis is infinitely safer than cigarettes and a lot of the other inhale mechanisms. There's just no chemicals in it. And again, even going back to the old government patent 6630507, it discusses the antioxidant, anti-inflammatory benefits of cannabis. So I'm kind of hit or miss on that. But as far as, again, in the acute phase and in concern of or exposure to Corona, I would probably do everything I could just to, it's better safe than sorry. And what's the old saying, an ounce of prevention is better than a pound of cure when it comes to possible lung issues and smoking or vaping. Greg Dane. Okay, so over-the-counter supplementation, again, big three, and I think Gordon mentioned that. Vitamin C, zinc. Elderberry is plus or minus right now. If you're acutely ill, I would probably avoid elderberry right now, just because we've seen a small subset of the population. It really amps up your immune system, which again, if you were listening earlier, heard me earlier talk about, that's a big discussion that people are having when it comes to the damage or inflammation that's happening to the lung tissue and microemboli and whatnot associated with Corona. So John, it's I don't think that hospitals in Tulsa have, at least, and I'm speaking on Tulsa because that's where my personal experience is, and I'm a hospitalist by trade, and that's kind of where most of my network is. Hospitals have never been overwhelmed. Now I will say, in 2 to 4 weeks ago, they were seeing, it's like every patient, every other patient was a COVID or Corona patient. And it's definitely not, well, I say definitely not right now. The numbers are way down. I think everybody's on the news that Hillcrest furloughed, but it's not clear cut that way, if that makes sense. Yes, we're having decreased patient counts, but the patients that are there are requiring specialized staff, specialized equipment, specialized areas of the hospital to decrease spread. So again, it's not something that is clear cut on the answer to that. Second and third waves, I don't think we're going to have second and third waves because so many people have already recovered, and people that didn't even test positive have recovered, and you're starting to have antibody production, which was the big problem with this to begin with. There was no previous exposure, no antibody production. I think it's going to continue to ebb and flow, but I don't see us having any more crazy outbreaks. Now, what could cause a crazy bad outbreak is mutations, which we're starting to see some graphics show that there's initially it was like, it's rapidly mutating. Then, well, we're not so sure it's mutating. And now they're saying, well, it's mutating a lot depending on country of origin, whether it's Wuhan or I think there was a variety around Korea as well that had just a small different genetic variation. And then more and more that's going to come out as we're able to study more and more acute illness. As far as smokers dealing with it better than non-smokers, it depends on what you're smoking. I would throw that out there. Uh, One thing that you have to think about is almost all smoking, whether it's cigarette or cannabis, that they're bronchodilators. And so I could maybe see that, but again, I'm a big believer in give yourself the opportunity, give your body everything it needs to heal and recover. So I would probably lean away from smoking if at all possible during that, especially during an acute illness or acute risk. All right. Greg, as far as doses, no. The only thing I will say is vitamin C, I always, so the zinc, I think you're great at 50 milligrams twice a day, once in the morning, once at night. Again, that can make you really kind of nauseous some people if you're not cautious with that. So I tell to watch that. Vitamin C though, and I will say that whenever I cut weight for fights, I cut a lot of weight. I cut from like 180-ish pound down to 145 pounds when I fight. And anybody that goes through that, I do it over 8 to 10 weeks, and I'm on a very strict and clean diet when I do that. But you're always at increased risk for infection because you're kind of just run down. So I typically increase my vitamin C to 1,500 milligrams at breakfast, lunch, and dinner. So a total of 4,500 milligrams or 4.5 grams throughout the day with my gallon of water, with my multivitamins and everything else. So anytime starting to get sick, or again, so Greg, you working in the medical field, I would probably just, for this time being, I would just keep my doses increased, just as a prophylactic measure. Shanna, natural cleaning products, vinegar. Telling you, vinegar works amazingly well. It's something that we kind of I use it in my like Whirlpool tub and stuff all the time. We see apple cider vinegar being ingested all the time, and it's a great natural product, but it also works very, very well to clean basic products. One thing that we know about with Corona that's a positive, and which is what can be so frustrating with this, is basic hand washing goes so long with this. People don't understand this. This virus dies very easily with basic hygiene and treatment. So, real basic soap and water and agitation typically will kill COVID. David, plasma transfer, big deal right now. There's actually just a thing on the news. There's a gentleman in El Reno or Enid that's looking for antibodies, and they're trying to look at possible using of like hemodialysis units and plasmapheresis. Plasmapheresis was a big discussion earlier on as well, but as far as plasma transfer, trying to gather up antibodies, again, that's where it's going to come back to. People are worried about these big recurrent spikes. I don't think we're going to see the recurrent spikes. I think we're going to see something. Don't get me wrong, because we're all come out of quarantine, and then you're going to have people that are just naturally carrying it, and it's going to get passed around again, but not to the severity and degree we had. We hope, but it's something to think about as far as antibody production, and that's what a lot of things are going to be going towards as far as looking at vaccines. And I'm probably going to catch some flack from this. I can tell you right now, I'm a big proponent of vaccination. My children are all vaccinated. I get the flu shot every year, but I don't see myself getting a COVID vaccine. Not something that's been rushed this fast. I think that there are people that could probably benefit from it. And if would my viewpoint and position change if I was immunocompromised or at serious risk? It probably would. But for where I'm at with no real medical issues or conditions, I'm in very, very good health. I'm very fortunate from that standpoint. I think that it's going to be an individual decision, but that's probably where mine will be. Let's see. Yeah, Gordon, again, I suspect you're right. I suspect that there was probably some folks that had it initially, because it's so hard to say. we're in a world that travels, I mean, constantly. And just because people finally were able to be detectable as far as a new subset strain, this virus, in many ways, it looks, you get co-infection with mycoplasma, pneumonia, and some other issues that people, I'm sure, were missed initially. Mayo Clinic, yep, they are absolutely working at different antibodies and trying to come up with some different ideas for transmission of antibodies for protection. And plasma. And I always encourage folks to donate plasma, whole blood. It doesn't matter, especially right now because folks aren't getting out, so the Red Cross is hurting. And if you're in the medical field, you would know that not just your individual, but just in general, we're always short for blood, always short for blood. And so having the capability to donate, especially if you have, AB positive, O neg, those types of things, it's something that we're always at a shortage of. And right now is no exception. John, yeah, I think you're right. I think that, like I said, I'm a big believer in vaccines and in what they can do. And I know, like I said, there's no right or wrong answer with that. I mean, there's going to be the anti-vax crowd that's going to be super mad at me, and there's going to be the other folks that are going to be on the other side. But I've just seen it now. Those are vaccines that over years and years and years and years and years have been modified and protected and what I would not say perfected, but worked on. And when you have something that's being rushed out, and it's just there's the body's an amazing complex machine, and to try to find something that's not going to interact with other organ systems, other medications, genetic variability. I mean, there's just so much there that not something that I'm in a hurry to jump on it and mess with. I know that. I'm sure that being in the military, and anyone that's in the military that's watching this, you know how the vaccine trials go, especially when we are working with pre-deployment, and you sit in line and get shot about 6 different times. So that's always interesting. Let's see. Debbie, do you think this week? Seasonal, absolutely. Are we going to have it to the same severity? No. Now, with one thing to consider and look at is same severity? No, as long as we don't have mutations. And we're going to have mutations. And I guess I probably even said that wrong. It's not even having a mutation, it's the severity and the degree of mutation. What makes the flu so bad every year is that it mutates, and the flu vaccine is a guesstimate on when it starts, and actually typically around China, and then it works its way west. And so as the flu works its way, it hits different areas. And so we have the CDC works with the agencies in London and everywhere else. And then they come up with try to guess work on the vaccine for that year. Sometimes they hit it right on. Sometimes they don't hit it very well. And so what we're going to see is that we're going to have a seasonal corona thing. What a lot of people aren't aware is corona. There's, I believe, 4, maybe 5 different subtypes that's the number one cause of the common cold to begin with. This one is just different because there's no antibody response to it. There's no preparedness for the body to fight it off. And I think that inherently is what's causing the biggest issue there. Let's see here. Lisa, right now it's depending on the state you're in. Oklahoma, it's about 2 weeks. The OMA has done a very, very good job with keeping up with everything, despite everything that's going on right now. I've been pretty impressed with them. They've been pretty responsive to things. So yeah, it's about a 2-week response right now to have your OMA license mailed to you. Let's see here. What other questions do we have? And again, guys, I've got, I'm going to repost the link here to the new product that we developed with New Pharma and Shep Paul. And then I'm also working with Ascension Hospice. And so if you have a family member that you would like cared for, by all means, let me know, and I'll be glad to try to get you taken care of. I'm a big believer in the hospice setting and being able to, as a physician, come and see the patient. And they allow me to do that. So I'm really big on that. So if there's anything I can do to help, whether it's hospice related, whether it's just answering questions, whether it's HRT, which we do as well, general medical, and then the cannabis side obviously is a big thing for me. I'll be glad to try to get you taken care of. How much jobs? Lisa, it just depends. The individuals, I believe they're $7.99, which is why I'm a big. It's kind of one of the things I said earlier that the one thing I don't like about it is I don't like the cost. I feel like it's a little bit high. So what we're working on is trying to get it at a lower point, but it's not something I recommend taking every day. I recommend it as a prophylactic. You can actually, again, you can type in licorice root and antiviral, and then there's a bunch of Lancet studies and NIH studies that pop up that will show you some of the different compounds in it were found to be especially potent against SARS, corona type viruses. So it just happens to come in together really well with the added benefit of CBD in it. And like I said, you can check on the website there. We've got Chip has done an excellent job of patenting and doing the research behind not just the endocannabinoid system, but how just routine spices. One of the things that I like to throw out there, a lot of people don't realize, Tylenol comes from the bark of a willow tree. And when you really start to look at what's available to you in nature, there's a lot of stuff. Now, with that being said, I'm not the big essential oil guy. I'm not going to sit here and say essential oils are going to cure cancer or anything, but I will say that there's a place in that a lot of these different compounds can be used with nutrition and diet and exercise and whatnot to do some pretty solid things with your immune system, general well-being, how you feel. And right now is a great time to really work on a lot of those things because let's face it, there's not a it depends on your whether you're an essential worker or not, but not a lot to be done right now outside of housework and honeydews. I'm actually drinking it's called Ugly Water, and it's not bad. Had some given to me the other day, and so I figured I would try it out. But it's definitely it's a different taste, that's for sure. Oh, let's see here. Big questions left. I'm gonna try to do this a little bit more often. Periodically, just get on, answer questions. Um, Anybody that has any questions or like wants some topics discussed, especially right now, I would be glad to get on and talk about them. You can always just post on the Evolve page or message the Evolve page, and I'll be glad to respond and then try to set something up. One thing I do want to throw out there from the back onto the cannabis side of things a little bit. I'm in the process of looking for about 25 dispensaries, give or take, in the eastern side of Oklahoma, northeastern side of Oklahoma, maybe even more than that, but that are, and I'm trying to really, I'll get to that here in just a second, Tiny, to look at the medical aspect. I have a ton of patients in their late 50s, early 60s that I want them to have a good opening experience with a dispensary. So you need to have staff that's very knowledgeable, the staff that can relate things and discuss things on a medical level as far as how cannabis could affect these patients. And I go over a lot of that, but it's nice from a dispensary standpoint. So that's something that I'm going to be doing as well, as trying to work out some different options with an app that we're creating, and then looking for what I consider, true medical dispensaries here in the state. Migraines usage. So right now, if I was to take all of my patients and break them in half, so men and women, my number one women specific diagnosis is migraines, and we're averaging between a 65 to 70% reduction in the number of migraines. Severity is usually about half as bad. And so what we know is we have a big group of nerves that innervate the frontal part of the face and the frontal sinus here. Um, we've seen the vapes and the inhale versions seem to work the best for, and they're more rapid onset, obviously, for symptomatic relief. Seems to do a really, really good job as far as trying to look at migraine, specifically migraines. Let's see. And as far as THC levels, it's going to depend on if you're using a concentrated versus other. The sativa dominant hybrids seem to do a little bit better, just talking to my patients in general, but there's a lot of variety there. Now, Greg, I think the big thing to look at is in the Korean patient populations that are retesting positive for corona after recovery, are they retesting for fragmentation, and that's a problem, or are they retesting for positive antibodies, or what? And with that, when they're retesting them, are they having true symptoms? Have they just not fully recovered? One of the big things we used to always talk about when I was an X-ray tech, and then going in and studied radiology for a while, and then going in internal medicine, is there is a 2 to 6 week lag in radiographic findings a lot of times, especially in the chest area, to the clinical presentation. And so you can still have opacities. And how many times we have a patient that gets readmitted to the hospital because of the fact they had a bad chest X-ray, but it's unchanged from 2 weeks prior, and it just hasn't resolved yet. So that is a very curious thought process, and it's something that I'd have to look at a little bit more and see. Sweet, I like that, Lisa. Lisa Nunley. So new cards are 75. Or the recommendation 75, the state fees 104 unless you have Medicaid or Medicare, and then it's $24, $25 right now. Okay, just a few more here, and then we'll call it good. Lisa, it's tough. Again, it's going to depend on what they're testing for, and it would depend on the amount of blood that they're testing too. The big thing, in my mind, the best test right now is going to be the antibody test that tells you whether you're IgG or IgM positive. And what does that mean? IgM is typically an acute illness or recovering from acute illness. IgG means you've been exposed and recovered from it at that time. So that'll be a big thing to determine on the finger test. I'll have to do some research, and I'll try to look into that over the next couple of days. Laura Matthews. So for the state of Oklahoma to renew, you'll need a new recommendation. You'll need to log into your OMMA account and then update your information there. You will not be allowed to do that from the OMMA until within 30 days of the expiration date that's on the front of your card. So you'll have to kind of monitor that and look and see. Perfect. And THC during pregnancy. So THC, we know that about 70% of THC is past the fetus during breastfeeding, during pregnancy, gestation, and whatnot. I typically highly encourage indica predominant use or higher CBD, lower THC levels, and preferably in the edible variety. I've had a bunch of OB-GYN docs and their patients to me just because of the safety of using an edible or something for nausea or abdominal pain and whatnot, or sleep, comparative to most medications is definitely, in my mind, the safer alternative there. But the lower the THC dose, the best for right now. We just don't have enough background information to know. And am I going to ever tell a patient? No, probably not. But I would just, like I said, lean towards the higher CBD dominant varieties. That's a really good idea. If I knew more about it, I need to. This is actually my first with this new. I've done live before on my cell phone and whatnot, but using an actual laptop and getting into the live creator that Facebook has. I'm going to play with it some more. I definitely was just going to kind of get on here and play with it, and I'll try to do that some more later. Didn't really have thought process on what I wanted to discuss. I just wanted to kind of open it up and update people, and then ask questions. But my goal is to be more available. I'm always here, but I kind of get so busy with everything else and being in the groups and the forums and responding to things that sometimes it's best to just be able to sit and talk to folks. And so no, I appreciate that a lot, and I'll play with this for sure and see what I can't figure out. Oh no, it's my pleasure. Love to try to spend some time talking about things. This is stuff that I enjoy. That's what I've kind of devoted my life to. Whether it's military or medical or just health and wellness, it's something that we've tried to set a little bit of a different standard for sure. One thing that if someone needs help, if someone needs medical care, if somebody to have insurance, have them message me. It's something that I can usually work a way to get someone taken care of for sure. Carry all. Yeah, I've stopped by Mango before. I need to um, I need to stop by Mango again and get some stuff. My goal is again to come up with a list of dispensaries in Tulsa. We have an astronomical number, and there's a ton of really good ones. Usually, what I do in my process is when I'm speaking with patients, I have the webcam pulled up for my telemedicine. I've got their recommendation form, their medical history and stuff. And then over here on the side, I have a Google Maps pulled up. And what I do is I type in the patient's address and zoom out so I can see what's in the area. And so my goal is to, within every 3 to 4 miles, have a good, solid, reputable medical dispensary that I can refer people to start with, because a lot of my patients, again, I want them to get a good foot in the door, because if they go to a dispensary and they're rubbed wrong, or they're scared off, or they're intimidated, they're not going to get anything out of it when they really could get some phenomenal quality of life improvements. I really appreciate that, Miss Pam. If there's anything I can do, like I said, let me know. I'll be glad to get it taken care of. Let's see here. Lisa, I'm going to send you a message real quick. To up. And again, I will be posting the business card, phone number, and everything else for Ascension Hospice. That way, if anybody needs it, they can get a hold of me that way as well. Or if you have a patient or a family member that you would like to have taken care of, I'd be glad to do everything I can to help out with that. All right, probably 2-3 more minutes. Let's see here. Angry. Yes, I'll definitely. 51st Memorial. I've spent tons of people over there actually. Haven't heard anything bad. I mean, I've got a list of places I've heard really good things about, and being in Broken Arrow, I really got the Broken Arrow area down pretty well. Let's see here for someone to get the car without insurance. So insurance doesn't cover anything cannabis related right now. And so for someone to get a card, you have your recommendation visits, which right now they're $75. Veterans are 60, pediatrics are 50, and a lot of times I try to discount those if I can. And then the state fee is 104 for 2 years. And the renewal process for that is going to be through me, 40 to 45. We're still kind of batting that around. And then the state fee, I suspect, is going to be the same, 104 for 2 years, or $25 if you have Medicaid, Medicare, or Center Care. Let's see. All right, y'all. I said feel free to share this, and if there's some other things or topics that you're curious about and would like to know more about, shoot me a message on Evolved or post on the Evolved page. I'll be glad to get that taken care of. We do have some, like I said, some really cool things coming along. We are in the works of producing an app that you'll be able to download. And my hope is that not only will we be able to integrate with some, like I said, the medical grade dispensaries, but um, give you updates on what's going on with the state, as well as just give you some good background information on cannabis and some different treatment options and whatnot as they become available. So appreciate everybody. Like I said, be careful, be safe, and holler at me if I can help.